Chapter 13, Segment 4, pages 426 through 430. Obesity is difficult to treat. Evolution has shaped our bodies to obtain and store energy. Almost 65% of the United States adults are overweight, and 1 in 3 of these individuals qualify as obese, based on the Body Mass Index, or BMI. The increase in cardiovascular diseases, diabetes, and other disorders that are associated with being obese will have a great effect on healthcare systems. Epigenetic transmission. Obesity problems may worsen via genes by parents passing down their obese genes to their children. Appetite control. Drugs to modify the functioning of the hypothalamic appetite system. So far, altering leptin signals has not been proven to be effective since only a minority of obese people have abnormal levels. Most actually have high levels of leptin circulating than thinner people do. Leptin regulates endogenous cannabinoid levels in the hypothalamus, so it is hoped that cannabinoid antagonists will suppress appetites by reversing hunger. Rimonabant is an inverse antagonist, and it works by interfering with signaling via CB1 cannabinoid receptors, and it effectively reduces appetite and results in weight loss. This also has a depressant effect, though, so it was removed from the European market. Drugs designed to target some of the signaling systems crucial to arcuate appetite controller. Drugs that activate the MC4R melanocortin receptor have the potential of being an effective appetite reducer. Lorcaserin activates serotonin 5-HT2C receptors found on the POMC neurons in the hypothalamic appetite controller. This produces modest weight loss. Treatment with the PYY336 via nasal spray acts directly on arcuate neurons to reduce appetite. When sprayed into the mouths of lab rats, it is not aversive and it produces a powerful appetite suppressant. Increase metabolism. Raise the body's metabolic rate to expand calories in the form of heat. The thyroid hormone, thyroxine, increases metabolic rate, so scientists are attempting to develop a drug that works like it without the cardiovascular side effects. Increase the cardiovascular activity of brown fat, which is rich in thermogenin. Thermogenin, UCP1, is a special mitochondria-containing protein that allows mitochondria to turn energy directly into heat. Various signaling pathways can activate brown fat, which provides a new target with regards to drug development. Beige fat cells are fat cells that resemble white fat, but express larger numbers of thermogenin-containing mitochondria. Beige fat is throughout the body and therefore it has the potential to burn excess stored energy at a high rate. Induce these via hormone or drug treatments and possibly even environmental manipulation such as cold exposure. Inhibition of fat tissue. Interfere with the formation of new white fat tissue. Angiogenesis is when fat tissue grows. It needs the addition of new blood vessels. So, by blocking this, we can possibly stop the formation of fat. Blocking the receptors for vascular endothelial growth factor, VEGF, which normally stimulates angiogenesis, inhibits the growth of fat tissues in mice. Reduced absorption. Orlistat, or Xenical, interferes with the digestion of fat. This medication has only produced modest weight loss, and it is usually accompanied by an intestinal discomfort. Reduce reward. Focus on the rewarding properties of food. Comfort foods directly reduce circulating stress hormones. Chronic food restrictions makes rewarding brain stimulations even more rewarding than normally, and through the use of leptin, this effect is reversed. Drugs that affect the brain's reward circuitry via reducing the rewarding properties of food may be beneficial treatment for weight loss. Anti-obesity surgery. The surgical removal of fat tissue. A popular approach is via liposuction, But this only has modest success, and it is only temporary success. Many people are turning to bariatric procedures that have to do with reducing the volume and absorptive capacities of the digestive system. Gastric bypass surgery does not directly target appetite control mechanisms. Rather, the alterations in the appetite hormones like ghrelin usually result from the surgery. Gastric bypass is only significantly effective and lasting treatment, but it is accompanied by many risks and complications. The development of less invasive surgeries are in the making by utilizing gastric stimulators that activate the gut's satiety signals to reduce appetite. When inert weights were placed inside the abdominal cavities of mice, they lost a great amount of weight by tricking the body into thinking it was heavier than it actually was. Eating disorders are life-threatening. Anorexia nervosa. The patient has no appetite, anorexia, and the disorder originates in the nervous system, nervosa. Characteristics of individuals suffering from anorexia. Typically, adolescent females and women have it a lot more than men would. They're extremely thin, usually through the utilization of laxatives, throwing up, over-exercising, or drinking large amounts of water to suppress their appetite. These individuals are obsessed with their own body weight, and they think about food a lot. They respond even more than a healthy individual would when presented with food. The food stimuli provokes a release of insulin, despite their cognitive denial of the feelings of hunger. And so these individuals have the normal sensation of hunger, it just isn't present in their conscious perception. The idea that it is primarily a nervous system disorder stems from the mismatch between physiology and cognition, and from the distorted body image of these individuals. Levels of agouti-related peptide, AGRP, are abnormal in these individuals, which suggests the hypothalamic appetite system may be abnormal. Twin studies suggest that there is a heritable predisposition toward anorexia nervosa. Leading factors of underlying physiological causes include abnormalities in serotonergic neurotransmission and alterations in functioning of dopamine-based reward system, and these persist even after recovery. Anorexia nervosa is very difficult to treat because it is a combination of genetic, endocrine, personality, cognitive, and environmental variables. But family-based treatment, also known as Maudsley therapy, from the hospital in which it originated, approaches seem to be successful, especially when they de-emphasize the identification of causal factors, and they focus on intensive parent-led refeeding of the individual. Bulimia. These individuals will gorge themselves full of typically junk food and then induce self-vomiting, or they will take laxatives to avoid weight gain. They also have a distorted body image, and they see themselves heavier than they truly are. They may be obsessed with the food and body weight, like those with anorexia nervosa, but they aren't drastically underweight like those that fall under the anorexic category. Both of these are fatal because the lack of nutrients damages various organ systems, and/or it leaves the body unable to battle what is typically considered a mild disease. Binge eating. People spontaneously gorge themselves with a great amount of food than that is usually required to satisfy hunger, often to the point of them feeling ill. These individuals are often obese, and there's a strong pleasure associated with food, which activates opiate and dopaminergic reward mechanisms. This almost resembles a drug addiction. Mutation of the gene encoding the MC4R receptor is also involved with binge eating, and so people with this mutation may be failing to receive signals to stop eating. The cutting edge. Friends with benefits. Contents of the gut may play a role in controlling appetite and energy balance. Each individual contains approximately 2.5 to 5 pounds of gut microbes. Trillions of individual bacteria belonging to dozens, possibly hundreds of different species, making it more than half of the contents in your large intestine. This means that you have more gut microbes than cells in your body, and they weigh more than your brain. Gut microbiota are also known as normal flora, the microorganisms that normally inhabit the digestive tract. The microbiome is the entire population of gut microbes as a whole. These provide a variety of benefits for the comfortable living space. Some researchers feel we should start treating the microbiome as a virtual organ because of its participation in bidirectional signaling with the brain. Enterotype. Each individual contains their own unique and distinct combination of different species of microbiota. This reflects your dietary history. Changes in your diet alters the composition of enterotype with unknown long-term consequences. For example, changing the balance of plant and animal sources, or of fat, fiber, and carbohydrate. Evidence has linked microbiome enterotype to device functions such as mood, anxiety, cognitive functioning, and various disease processes. Changes in gut microbiota due to antibiotics may have an association with Parkinson's disease. The area where an effect is most prominent in changes in gut microbiota is obesity. When young mice are fed antibiotics in even low doses, changes in gut microbiota and circulating hormones led to weight gain. In addition, two studies looked at almost 40,000 babies and found that human infants given antibiotics in their first 6 months were statistically more likely to be overweight at age 7. Fecal transplantation, a procedure to rebalance gut microbiota. Feces are collected from donors and are processed to create a liquid suspension, and then this is passed via catheter into the colon of the recipient, and the healthy enterotype will establish itself there. One transplant has the potential to cure dangerous intestinal infections associated with bacteria, such as Clostridium difficile. Fecal transplantations also reverse insulin sensitivity, which is a hallmark of type 2 diabetes.